Yeah. Good evening, everyone. I'm Pavishri from Annapurna Medical College, and it's a privilege to serve as a moderator for today's session on behalf of Public Relations Subcommittee. I extend a very warm welcome to our esteemed speaker and to all the participants who have joined us today for this interactive discussion, White Coat Silent Struggles, a candid conversation on mental health in medicine. At the beginning, I would like to respectfully acknowledge the constant guidance and encouragement of the patrons of IMA Tamil Nadu State Branch. Dr. B. Sridhar Sir, State President IMA TNSB, Dr. P. Sengutavan Sir, Past President IMA TNSB, Dr. A. K. Ravikumar Sir, President-elect 2026 IMA TNSB, Dr. N. R. Tyagarajan Sir, President-elect 2027 IMA TNSB, Dr. M. Thiruviyam Mohan Sir, State General Secretary IMA TNSB, Dr. D. Solomon Jaya Sir, State Finance Secretary, IMA TNSB. I would also like to convey my sincere regard to our state leadership team, Dr. R. Annamalai Sir, Chairman, IMA-MSN TNSB, Dr. S. Jamuna Rani Ma'am, Co-Chairman, IMA-MSN TNSB, Dr. V. S. Hariharan Sir, Chairman, IMA JDN TNSB, Dr. Kannan Rajendran Sir, Convener, IMA-MSN Subcommittee, and a special appreciation to the state team members who continuously support the activities of the Medical Student Network. Dr. Arunagiri Sir, Convener, IMA MSN TNSB, Dr. Ajay Karthik Sir, General Secretary, IMA MSN TNSB, Dr. Bala Hariharan Sir, Co-Convener, IMA MSN TNSB, Dr. Hariram Sir, Co-Convener, IMA MSN TNSB. We are gathered here during Mental Health Awareness Week, and I believe there is something deeply meaningful about the fact that we, as medical students, are choosing to have this conversation openly. We learn about mental illness, we diagnose it, we counsel patients, yet many of us still hesitate to seek help for ourselves. Today's session is not merely a lecture, it is intended to be a candid and honest dialogue, a safe space where doubts, fears, experience, and questions are welcome. Together, we will explore and challenge some of the common myths we often hear, such as doctors should be mentally strong, psychiatric help is only for severe illness, seeking help may affect one career. Anonymous question will remain open throughout the question. Participants may use the Google form or chat window, and our team will help moderate them. It is now my pleasure to introduce our speaker for today, Dr. Aiswarya R. Kamath ma'am. She is currently a senior resident in the Department of Psychiatry at Amrita Hospital, Kochi. She completed her MD in Psychiatry from Trivandrum Medical College and holds a DNB qualification with specialized expertise in child psychiatry, women mental health, de-addiction psychiatry, and psychotherapy. She is also a passionate educator who has conducted workshops on emotional regulation skills in DBT and presented on mindfulness based intervention in psychiatry at the annual Kerala State Psychiatry Conference. We are truly honored to have you with us today, ma'am. I believe there is no one better placed to help us bridge the gap between knowing about mental health and actually seeking help when we need it. Without further delay, let us begin today's session. I now ask Sai Shakti to take over. Thank you.
Good evening, everyone. I'm Sai Shakti, currently doing my final year of medicine. It's my pleasure to serve as the moderator along with Pavishri for today's online session titled White Coat Silent Struggles. So today, we are gathered here to have honest and meaningful conversations and to acknowledge and discuss the struggles that are often left unspoken. So without further delay, let's begin with today's session. We are honored to have with us today Dr. Aiswarya ma'am, who will be sharing her perspectives on mental health, and she'll also be helping us to come up with coping strategies for various mental health struggles. And we also have a myth-breaking session. So, ma'am, with your permission, can we start with the myth-breaking session for today?
Sure, Sai Shakti. Let me thank Sai Shakti and Pavisri for the warm introduction, first of all. And I also thank IMA GDN Tamil Nadu for this opportunity. I think, like Pavisri mentioned, it's courageous and it's a very logical decision that you people have taken to conduct such a session, especially not just a lecture but an interactive session. And I really hope we have a good interactive session, not just listening to me. I hope you people, ask doubts so that it becomes a two-way conversation. And as you all know, this is a mental health awareness month. Our May month is Mental Health Awareness Month, and such a session is going to be useful for all medical students, I believe. Thank you. And like you said, we can start with the myth busting session.
Thank you, ma'am. We are looking forward. So the first myth that we have online is the society still continues to believe that if you ignore the illness, it will go away on its own.
Right, right. Yeah, this is a very common advice that our society gives whenever a person opens up about their emotional struggles, or when they say that I'm not doing well mentally. Many people say you should just ignore it. It's all in your mind. You should just let it go. You should enjoy your life. But the thing is, it doesn't go away like that. Just like any other medical illness, psychiatric illness also has neurobiological basis. And if a person could ignore it, they wouldn't come to you saying that they are struggling. So it's really a bad advice to give that you should ignore your mental health. Right.
Thank you, ma'am. That was clear. And the next one that the society often tells is that children don't get mental health problems.
Yeah, yeah. So this is also a common myth that's true. Uh, we think that children have no stress; they're carefree. It's their job to enjoy, play with their friends, and just be happy. But that's not true. Like I said, all psychiatric illnesses have neurobiological basis as well. Children also suffer from anxiety sometimes. They also get depressive episodes sometimes. And some children, when they're not able to handle their stress, they take it out on others. And that is when we call it oppositional defiant disorder or conduct disorder. Also, early onset psychotic disorders are also coming up in children. So it is not true that children do not get affected by psychiatric illnesses.
Thank you, ma'am. The next one is mental health problems are caused by bad parenting only.
Yeah, yeah. Many people would like to, it's very difficult to first of all accept that you have emotional issues, and we find some reason to, explain why we have emotional issues. Though parenting does play an important role, it is not the sole reason. So I always say psychiatric illnesses have biopsychosocial explanations. So biological means there are genetic factors, our temperament, and our own nature. So some children, when they're born, they're very quiet. Some are always crying. Some are very neutral. They are emotionally cold. So it begins from the genetics. And whenever there is a stress or a very stressful situation, there are alterations in the chemicals that control our mood, happiness, and cognition. So that is the biological basis. Then comes our psychological basis, which again comes to how we deal with things, how we cope with stress, our resilience, our skills on how to deal with stress. And then third comes the social aspects. So social aspects is where parenting plays a role, as well as the society plays a role, as well as the experiences that a person goes through. So these three factors are, what are responsible for psychiatric illnesses. Though parenting has a role, it is not the only factor that causes psychiatric illnesses.
Yeah, ma'am, that was clear. The next one is eating disorders are only about food.
Yeah, yeah, right. Because the name is eating disorder, make people think it's only about eating. It's only about eating food, right? So always, eating disorders have many different presentations. Like most of you know, there is anorexia nervosa, there is bulimia, there is binge eating. Most of the time, anorexia and bulimia arises because of their body image issues. People feel, even though they look healthy, they are in the normal BMI range. In spite of being a healthy person, they may believe they are fat. So they try to either reduce their food intake, or they eat too much and then they try to vomit, or throw it out. Okay, so that's how anorexia and bulimia comes. And in binge eating disorder, what happens? They're not able to control. They're not able to resist the urge to eat food. So it's not just about them eating food. It's about the body image issues, the ability to control. So these factors are also important in eating disorders.
Thank you, ma'am. The next one is if someone laughs and socializes, they can't be depressed.
Yeah, this is also very common. So people say, "Oh, he looks very chill. He looks like a happy person. So he must not be depressed." But the thing is that person might be struggling inside, and to keep a happy face, he might be putting up a show, pretending to be happy, which itself is a pressure. So a person who is already going through something emotionally has to pretend to his friends or family that he's okay. So the stress is, even more than a person who is just suffering from any psychiatric illness. Often a society has expectations and people, try to put up a good show. You might have heard of the concept called smiling depression. It is said to be common in people who are in the public eye, okay, who are very social, who are, celebrities. They cannot afford to let people know that they are depressed. Hence, they pretend to be happy and they struggle to, go through their life, yet they pretend to be fine. But the thing is, they are, they need all the help. We cannot always judge just because a person is smiling, they're totally okay.
Thank you, ma'am. Trauma only affects weak people.
Oh no, that's not true. Trauma can affect any person, not just a vulnerable person or person with biological vulnerability or any personality issues. First of all, we should understand what is trauma. Trauma is when a life-threatening situation happens, when a life-changing situation happens. It could be, facing an accident, road traffic accident, where you might have gotten killed, but somehow you escape. But you witness and go through all the horrors of a road traffic accident. It may be physical abuse, somebody getting beaten up. It might be sexual abuse. It could be any kind of emotional abuse that affects a person's mental health. So not every small thing is a trauma, but it is when a person's capacity to deal with something is the stress that comes is beyond the person's capacity to deal with it, and it is usually life-threatening situations that can be accounted as trauma. So anybody who goes through it may suffer from the consequences, like you might have heard of PTSD, post-traumatic stress disorder, or anxiety issues, phobias, etc.
The next one is psychiatric medications are addictive.
Yeah. This is a very still popular myth that people like to believe, and people are often misinformed. Most of the psychiatric medicines are not at all addictive. There is only one category of medicine that is addictive, which is benzodiazepine. Since you are medicos, you might be aware of this category. Benzodiazepines are also called sedative hypnotics that usually we write for a short-term basis for getting a relief for the time being. It's not written for a long time. Hence, you can say most of the psychiatric medicines are not at all addictive. All other categories, like the antidepressants, antipsychotics, mood stabilizers, and other categories as well, they are not at all addictive. But they go and correct the imbalance in the brain. Like I said, always the psychiatric illnesses have a neurobiological basis because of the chemical imbalance. Psychiatric medicines go and correct it. So it doesn't cause addiction.
Thank you so much, ma'am. So now, before we continue with the myth-breaking session, we would like to pause and hear from you your perspectives on mental health struggles and your coping strategies, ma'am. So over to you for your session, ma'am.
Right. Thank you. So it was a good idea to have a myth busting session, and I appreciate that you people ask people to ask their doubts even before the session. Usually, when there is such a session, it is asked in the chat or after the class. So this was a good idea. I will start with the topic, and in between we will discuss.
Sure.
I'll do. I'll start sharing the screen. Okay. Yeah. Tell me. Yeah. So you're asked, okay. Okay. So you are asking me if somebody inspires you and then you try to copy or imitate them, is that okay? Is that your question? Okay, understood. So these are two questions, whether we should handle our inferiority complex or we should copy, and is that okay? So, right, inferiority complex is not a good thing. Uh, Everyone, and I wish everyone would understand that nobody is inferior to anyone based on any of their, features, based on their caste, based on their sex, appearance, or the job they do, or any other criteria you might think of. Um, and first of all, we should be trying to handle or manage and come out of our inferiority complex. Then we'll not have to copy somebody to feel better. Copying somebody to feel better may not always work. But like I said, if we find somebody inspiring, if we find some good qualities in others that you think you can also adapt in your life and you're comfortable with that, then there is nothing wrong with that. Okay. So we see many influential people like our father of our nation, Mahatma Gandhi or APJ Abdul Kalam. They did many inspirational things, many courageous and many innovative things that has affected generations. So taking inspiration from them and taking some ideologies from them and trying to apply it in our life might actually benefit us. But if we do something like changing our dressing style to something that we are not comfortable with, we try to completely copy somebody just because they look cool or they seem better than us, that may not always work. If you're comfortable and if you can align your ideologies and values to that person's, and you are able to adapt it in your life, then it is fine. So to summarize, inferiority complex is not a good thing, and there is no need to feel inferior. If somebody feels that they're inferior to somebody, that should be addressed first. Imitation is good when you're comfortable with it and it aligns with your values. I hope I answered your question. Oh, thank you. Thank you for that question. So we will move on to our topic. And if somebody has any questions to ask, I think the moderator can let me know. Somebody can ask the question in the chat, and the moderator can ask if it is really relevant. Otherwise, we will keep the discussion after the presentation. Okay.
Sure.
Yeah. So I think most of the people who are attending this session are medical students, or new doctors. So getting the medical branch, getting MBBS seat in India is a dream come true, right? Everybody is proud of you. You yourself are proud that you have finally achieved this dream that you held close to your heart. But it comes with a lot of challenges. Most of you might be aware. So we will discuss first of all why medical students are a bit more prone to stress and emotional issues than maybe another branch student. So in medical students, perfectionism and imposter syndrome is very common. So till you got MBBS, most of you were high achievers. You were good at studies. You were, toppers in your class. But once you come to MBBS, all were toppers, and not everybody can be a topper. So in such a competitive environment where everybody cannot be a topper, that person may, start to question their abilities, and they start viewing academic struggle as a personal failure. We often learn about mental illnesses in textbooks. But most of the times in the Indian system, the institutional culture signals that admitting vulnerability is a sign of weakness. Like in the myth busting session, we already discussed there is so much stigma about emotional issues. When somebody admits something that we need to address. So this hidden stigma itself creates problems for medical students. Then chronic sleep deprivation and burnout. So in the medical syllabus and in the clinical postings, there is massive volume of information along with demanding shifts. Like many of the times, once you start your third year or final year, you might start getting night shifts. Then when once you go into internship, there are night shifts that are even more frequent. Along with that, there is so much to study, be it in MBBS or in internship, you are studying for one exam or the other. So dealing with this work as well as studies sometimes becomes very hectic. And these night shifts also disrupt our circadian rhythm and our sleep wake cycle. It can worsen underlying emotional dysregulation and cognitive fatigue. So people might be also dealing with other stressors in their life, like their family issues, relationship issues, financial issues. So along with that, when there is a lot of information that has to be learned and there are frequent night shifts that come, that person becomes even more vulnerable. Then there is the fact of vicarious trauma and early clinical exposure. So when there's a transition from classroom to wards, that usually happens from second year in most of the medical colleges, it exposes young students to acute human suffering. So till now you were studying in school, in first year also you are not so exposed to clinical problems, but from second year you are suddenly starting to go to hospital and you see suffering. There is terminal illness and there is often death that you come across, and most of the medical students are not prepared for this. They are not having the adequate emotional strength. Many of the times nobody might have briefed them that such scenarios can happen and it might affect their mental health. So this happens often without any formal emotional debriefing or processing systems. So this is why uh, mental issues, emotional issues are becoming common in our medical system. So let us see what are the common mental health problems in medical students and doctors. So anxiety disorders and depression is are two of the most important and common mental health issues that medicos face. So how do we know if somebody is suffering from anxiety disorder or depression? So let us see some of the common symptoms of anxiety disorders. So anxiety disorders is a spectrum and there are different types of anxiety disorders as you may be aware, like panic disorder, wherein there is increased heartbeat or we call palpitation, which is episodic. There can be trembling of hands, sudden sweating, shaking, and the feeling that you might be something is going to happen to you and you might even die. Some people get choking sensation, tightness in the chest that usually lasts for 15 to 20 minutes. Then there are other anxiety disorders like generalized anxiety disorder, where there is free floating anxiety. Some other anxiety disorders you might be knowing: social anxiety disorder, phobias, agoraphobia, etc. Versus depression. So let us see what are the common symptoms of depression. So just because somebody is sad, we cannot say he's depressed, which is get the word depression, that saying that I'm depressed is often used uh, commonly, even though person may not be actually depressed. So let us see when can we call somebody being depressed. So it happens when when there is a pervasive sadness, a long-standing depressed mood most of the days, and for most of the day or every day for at least 2 weeks. There is also reduced interest or lack of pleasure in the activities they do daily, and also even they don't feel any pleasure when they do the things that they like, their hobbies or their passion. They don't feel any kind of joy. There may be disruptions in sleep, weight, appetite, etc. There may be feelings of worthlessness. I'm not good enough. I've done a grave mistake. So there may be worthlessness, guilt. Then there may be concentration difficulty, and in severe depression, there may be thoughts of dying, suicidal ideas, etc. So these are the two important common mental health problems. Other problems you might be well aware, burnout that happens in doctors who are working continuously without getting break for days together, and when the patient load is too much. It is very common in branches dealing with terminal illness, chronic illnesses, etc. Then there can be adjustment difficulties, or what we also call adjustment disorders. That usually happens when people are suddenly exposed to something that they are not used to or that they were not expecting. It can happen when somebody joins for MBBS, when the final exams approach, when they see a suffering patient suffering suddenly. There can be adjustment disorders wherein there is a change in their mood. There can be sadness or always feeling anxious that can disrupt their sleep and appetite. But it usually resolves within 2 weeks following the stress. Okay. Then there can be sleep problems. Usually in medical students, it is because of the night shift and stress. Okay, there can be insomnia, there can be difficulty initiating sleep, maintaining sleep, or there may be early awakening. It is also seen in anxiety as well as depressive disorder. Then, because of poor coping skills, some people go for using substance of abuse like alcohol, cigarettes, cannabis, and other substances you might be well aware of. And some people go for self harming tendencies because of poor coping. Some medical students also suffer from undiagnosed ADHD, wherein they find it very difficult to attend with full concentration. Some people have difficulty sitting in one place for a long time. There may be impulsiveness. If you feel you have any of these problems that you mentioned till now, that is affecting your functioning, it is causing struggle in daily life, you should definitely seek help. So coming to stress, there might be nobody in this world who has never felt stress. Okay, once our brain develops and we face things in our life, there is it is unlikely that people have not experienced stress. So let us see, how do we know when we are stressed? Usually, when somebody is stressed, there is emotional, physiological, as well as cognitive changes. So I'll give you a minute to type in the chat, and the moderator can read out to me. What are the common emotional issues you might have when you are stressed? What are the physiological changes, that is, bodily changes? And what might be the cognitive problems you might have when you're stressed? We can take a minute, and participants can put their answers in the chat, and moderator can read. So are we getting answers?
Yes, ma'am, I'm getting answers.
Okay. Okay, shall we discuss that?
Yes, ma'am. Ma'am, one of my friends have said that emotional breakdowns.
Okay.
And not feeling enough.
Okay.
And the other ones are no amount of sleep seems to help.
Hold on.
And the other one is bringing out the emotions on people who don't actually deserve that.
Okay.
And irritability. These are certain responses that I've got from people.
Okay. So the answers are, right. Let us try to divide them into these emotional, physiological, and cognitive. So the usual emotions when you are stressed are not going to be pleasant. There is usually going to be anxiety. There's usually going to be guilt feeling like you have done a mistake. I'm not good enough. I'm always wrong. I will never improve. These kind of thoughts can come, and it is usually unpleasant. So there can be sadness, anxiety. Some people may get frustrated and angry. That is when, like you mentioned, we take the anger out on somebody else. We get, we shout or throw things, etc., which is not, again, a good coping. Then physiological changes, you might be well aware. There may be increased heartbeat. You might start to sweat. You might start to feel giddy. You might get, headaches. You might have reduced appetite. You might have disturbed sleep, fatigue, etc. Then coming to the cognitive components, usually there is reduced attention. You might some of you might have experienced in exams. Some people go blank, even though they have studied well, because of feeling so anxious, they're not able to remember most of the things that we studied. So there can be reduced attention, there can be memory problems, there might be difficulty to focus. So these are usually the signs that you are stressed. So you all can think of what usually triggers stress in you. It might be exam, it might be some professor scolding you, it might be family or financial issues. So let us see whether stress is good or bad. Okay. So some amount of stress sometimes helps us to perform better. But when our capacity is less than what is demanded, it becomes too high. The stress becomes too high. So there is a term called eustress. Eustress means which is good for optimum functioning. Like you can see in the graph, on the y-axis there is performance, and on the x-axis there is demand. So as the demand goes on, the stress goes on increasing, and at the same time, our performance also starts to increase. At optimal stress level, when our demand and performance is matching, there is peak performance and we are able to give our best. But when the demand is beyond our capacity, it becomes too much. We feel overwhelmed and pressurized, and our performance again goes down. So there is eustress, and when the stress is beyond our capacity, it is called distress. So let us see some of the strategies. Quickly, you can all think of, what are your usual strategies for dealing with stress? Let us see one by one. We discussed common mental health problems and what happens when the stress is too much. When should you be worried? When should you be concerned for a friend or yourself that you might need help? Some of the warning signs are crying spells. You're not able to stop yourself from crying. You are, continuously crying without being able to be consoled. Some people try to advise you, they try to, distract you, but you're not able to stop crying. Then, when there is suicidal thoughts, like I mentioned, usually happens in depressive disorder or in severe traumatic or very stressful situations. Then there is inability to sleep in spite of opportunity for days together. Then poor concentration for long time. Few minutes or few hours might be usual for some people, but poor concentration that is affecting your functioning. Then you need to seek help. When there is chronic fatigue, in spite of sleeping enough, in spite of eating food, in spite of taking enough water, you're always feeling fatigued. When there is weight loss or even weight gain, a significant weight loss or significant weight gain is also problematic. Lack of interest in any of the things that we used to like to do for a long time. Recurrent physical problems like recurrent infections, recurrent gastric problems, uh, recurrent headaches, body aches, etc. These are some of the warning signs that indicate that you might need help. So let us see some of the unhealthy strategies people use and some of the healthy strategies people use. Like earlier, somebody mentioned taking out our anger on somebody else when we are stressed. It's not really a healthy coping strategy. Second one is avoidance. So I am afraid of something. I am very anxious to attend a given exam. I avoid it and I go distract myself with something else. But what happens? The anxiety stays. You are again afraid of exams. You do not face it, and avoidance is never the solution. Using substance of abuse to calm yourself. It is an unhealthy strategy that may go into addiction or even severe psychiatric illnesses. Eating more or eating less. Some people, eat too much because they feel better when they eat. That is called stress eating commonly. So these are some of the unhealthy strategies. There are several other unhealthy strategies you might be aware, like harmful ones, harming yourself, rash driving, uh, uh, avoiding classes and doing unproductive work like using our phone too much to distract ourselves instead of dealing with what should be done. Okay. Then healthy strategies include sharing, opening up to somebody, sharing what you're going through, sharing your happiness, sharing your sadness are all healthy strategies. Relaxation exercises are very helpful sometimes, like meditation, yoga for some people, muscle relaxation exercises for some people. Then another healthy strategy is preparation. So we are afraid of something. Instead of avoiding or postponing it, if we start preparing for it from early itself, it gives us a good advantages and we are better prepared and confident to face it. Then seeking help. Instead of keeping it to yourself, if you seek help from somebody, it is always wise and it is a healthy coping strategy. So one thing you can easily remember is this acronym, please. For all medical students, try to treat your physical illness first. If you are not physically well, you are more vulnerable to get emotional problems. E is for balancing eating. Always remember to eat balanced food, not always the fast food. People staying in hostel and all, they always tend to depend on noodles, then tea, coffee, cool drinks, and food that has a lot of sugar and maida, etc. So try to avoid that. Then A is for avoiding mood altering substances like substance of abuse like alcohol, cannabis, and even too much of caffeine, tea, coffee, etc. Ensure that you get adequate sleep. And E is for getting exercise. So how much exercise should we get? Anybody knows? So at least for 5 days of the week, make sure that you exercise for 15 to 20 minutes. Always moderate level of exercise is beneficial. Easiest one being walking, light jogging, if you're going to gym, treadmill, and other cardio exercises. So that's about the acronym, please. Next is developing our coping skills. So when we're stressed about something, think if any solution is available. If any solution is available, seek it and do it. And if the solution is not available, get help from somebody you can trust or a mental health professional. Always, when we're going through a stressful situation, for example, an upcoming exam, we always tend to have all or none thinking. Like, if I don't perform well, my future is gone. If I don't pass this exam, then there is no point in living. If I get good marks, I am the best person. So it's not always like that. No exam is a do or die situation. It's not the ultimate exam. Okay. But so if you start thinking this way, it adds to your pressure. So try to give your best instead of thinking of worst case scenarios. Some people go for magnification and minimization. What do you mean by that? Magnification is when we magnify the problems within us or magnification of our losses. We tend to zoom in and make a mountain out of a molehill. Okay, for example, somebody has scolded you. You tend to focus on that only. Sometime that person, maybe sometime in the past they might have appreciated your skill, but you tend to focus only on the negative situations. Example, you failed one exam, but you have passed four exams. You tend to focus only on the failed exam and tend to think everything is over. Minimization is for minimizing our successes. We tend to focus less on our talents and successes and tend to focus more on all the negative things and failures in our life. So if you have such habit of thinking of magnifying your failures and minimizing your successes, identify that and change it. Also, if you have all or none thinking, identify and correct it. Always think when a situation happens, is this going to affect my life in the long run? Then managing your time as a medical student is also very important. So this chart that I have used can be used to divide the tasks that you're supposed to do into most important and urgent should be done first. So if there is any deadline, there is any crisis that you have to do, you have to address that first. Do first that. For example, you have 2 days to submit an assignment. That will be the highest priority. Second priority will be not urgent but important. Okay, deadline is in 2-3 weeks, or you are having some event coming up in 2 weeks. You can schedule it and start preparing for it later after your first priority thing is done. Third one is urgent but not so important. For example, any activities that you wanted to do to improve your health or mental health or upcoming meetings that are coming that may not be always doable at present. So you can ask somebody to help you plan the meeting. If you have exercise or any hobbies that you wanted to do, you can ask people to come with you or remind you so that you are accountable for it. So that's about delegating work. And some things are not urgent and not important. These are time wasters. For example, scrolling through phone, hmm, doing only pleasant things, roaming to places when you have lots to study, then going behind trivia, gossip, etc. So you can divide your tasks at hand into these four categories. Okay. When you divide your task this way, always think of what would matter to you the most and make time for things that are important to you in this manner. What in the end, at the end of your life, what would matter to you most? Make sure you find time for that as well. Then every medico should be aware of assertiveness and learn communication skills. So, if you say yes to everything, what happens? You get overwhelmed with all the work in the world. People tend to put a lot of work on you. Okay, it might be a good quality doing the work that your seniors give might be a good quality, but it is not always a good idea to say yes to everything because then you will be overwhelmed and you might not be able to do the things well. So you also need to learn to say no. So this is a diagram. There is a fine line and a margin between aggressive and being passive. So when you do only the things that you want, it is aggressiveness. You are not thinking of others. You are only thinking of yourself. It becomes aggressive. When you do only the things that others want, it is passive. But when when you do the things that others want, but is also important to you, and which you can help others with in your limited capacity, that is when assertiveness comes in. When you have to say no and something is going beyond your capacity, you have to say no in a polite but firm manner. Then you should always learn some relaxation techniques whenever that you can apply on a daily basis as well as in a crisis situation. Things that you can apply on a daily basis are meditation, yoga, and muscle relaxation exercises. Okay, where you tighten and then relax your muscles from head to toe, taking some time. Okay, if you want more in detail, you can ask me in the end or message me. I can send you the details. Whenever you are in a very crisis situation, when you are facing an unexpected stressful situation, you can practice this breathing exercise of 4-7-8. That is when you take 4 seconds to inhale, 7 seconds to hold your breath, and 8 seconds to exhale. So these are some of the relaxation techniques that you can learn. And for medicos, you should be warned and you should be careful about social media. You should always use social media judiciously, carefully. Not always give medical advice on social media. Do not always engage with unknown people on social media and fall into any financial fraud situations. And always remember your ethical boundaries. Always keep a professional boundary between you and your patient, and even your relatives and well wishers who might ask you about medical doubts. Always remember to keep the professional boundary. And if you are new going into MBBS or internship, you should always know whenever a case is medico legal. If you doubt anything legal may be associated with the case, ask your seniors before you document something, ask their advice on how to counsel the patient, etc. Documentation is important because whatever we document becomes a medico legal document. Noting down the injury, noting down wounds, noting down abuse, etc. is always very important. And always take advice from your seniors if you are doubtful about it. Then something that we all should know is breaking bad news. Some of you might know the protocol called Spikes protocol. Okay. You can go back and read how to break bad news. And the Spikes protocol is the acronym SPIKES. Then smart work versus hard work. Okay. So some people tend to, after they have finished schooling, they tend to do hard work, which goes beyond their capacity. So if you are nearing exam and you think that I will finish this textbook in one day, it is going to be not possible. So always towards the exam at least you should have your notes ready, and you should be doing last minute revision instead of thinking you can finish a vast topic at a stretch. So that is smart work versus hard work. Then, like I already mentioned, keep a professional boundary. There can be transference and counter transference. Are any of you familiar with the term? So transference is when a patient develops and projects a relationship towards the doctor. So, for example, you give them advice on how to take care of their health, mental health, etc., and they keep you in this fatherly figure. You are like a brother to me. They think it is not just a doctor. I have a relationship beyond just doctor-patient relationship, and they start to act accordingly. Okay, so always get them back, you know, to keeping a professional boundary. So whenever you feel the patient is, violating this and they're calling you by name or calling you mother, father, brother, etc. Always remind them that this is a hospital and you are a doctor. You can the patient can call you with the name acronym, or if you are not past MBBS, with your name. Okay. Then counter transference is something the doctors develop towards patients. So a doctor feels that, okay, this patient reminds me of my daughter, this patient reminds me of my mother, and you tend to talk to them in that manner, like how you're talking to a family member or any other kind of relationship. When you identify yourself doing that, come back to your professionalism. So, about mental health, what you can suggest to be implemented in your institute is that psychological services be independent of academic grading and evaluation. So, one of the fears most of the medical students have when they approach their teachers or professors about opening up about their emotional health, they fear that, okay, they may, it may affect my grading. The professor may judge me, etc. So in the present generation, that trend is improving. Most of the professors are more welcoming than being judgmental. Okay, but if you find or if you feel such a discrimination or judgmental attitude is there, you can approach the higher authorities that this should be independent of academic grading, and whatever you talk to your senior should be confidential. Then peer mentorship programs, which is being implemented in many medical colleges. But if it is not being implemented, you can ask your higher authorities to do so, because it helps to build an approachable relationship with a person whom you can approach whenever you are facing a difficult situation. Then coming to work-life balance, you should always remember that you are not just a doctor, you are a human being with a lot of roles to fulfill. There should be distinction between your identity as a medical student or a doctor and being a human being. Because whenever you think your identity is restricted to being a doctor, that limits your potential, and you also tend to blame yourself whenever you make mistakes. Many doctors and many medicos see their mistakes as a scope, as an indication of their poor self-worth. So if I do a mistake, I'm the worst doctor, example. But always understand that mistakes can happen. You're a human being, and whenever you make a mistake, you learn what went wrong and try to improve yourself. So remember, you have an identity beyond your degree. Always be careful about compassion fatigue. You know, when you deal with emotional problems and illnesses like terminal illness, where the patient, their bystanders, and you yourself are helpless, and you have to deal with it on a daily basis, you may have compassion fatigue. You may suffer from it, wherein you feel numbed, you feel drained, and you may get irritable, which is very similar to burnout. But compassion fatigue is very specific to medical profession. Always remember to pursue your hobbies, talents, and if you don't have any hobby, find a hobby. And always remember to seek help if you're feeling you're going through a difficult time, you're not able to deal with things. Open up to somebody whom you can trust. Do not hesitate to get the professional's help, because seeking help is a professional thing. If you are struggling emotionally, you are also at the risk of making more mistakes. So it is always a sensible and a brave decision to seek help when you are not doing well. It is not a sign of weakness. So always think, if you had a physical illness like fever or a fracture, you might not hesitate to seek help. Likewise, if you get a mental health problem, why would you hesitate? Why is that your own stigma? If so, identify and do not hesitate to seek a professional help. So, and let me conclude on with few words on how to help a friend who is going through a difficult time. So, as most important skill that you can develop is to listen. Listen without giving advice at the first instance they come to you. Okay, listening is the most helpful thing that you can do instead of giving a lecture. Okay, so once a friend comes and opens up to you about difficult thing, saying, "Oh no, you should think positive. I too had a difficulty. I overcome it." No, first of all, listen to them to understand them patiently. Then, if somebody talks to you or comes up with this suicidal ideas, whether if they are going through a situation where constantly thinking about dying, it should be taken seriously, and you should warn their family as well as a professional or your professor, whomever can help you. You should inform them. Then encourage your friend to get professional help. You should also know what not to say. For example, person talks to you about difficult things. You say, "Oh, you're always telling me negative things. Why can't you think positively?" And if somebody says, "I'm not doing emotionally well," you say things like, "Oh no, you should just chill. You should, go out. You should go out and enjoy." These kind of statements are very invalidating. So always remember to validate a friend's emotion, and you should also know what not to say. Should be careful with your words when you are trying to help a friend. So with that, we come to the end of the discussion. So uh, thank you all for patient listening. I think we can get back to discussion.
Thank you so much, ma'am. That was such a meaningful and helpful session, ma'am.
Thank you. Thank you. You're welcome.
Thank you so much, ma'am. Now, as we come back to our mid-breaking session, the first one that we have to discuss is there is a myth that people who need counseling are probably very depressed in life and have suicidal thoughts, or they are retarded and mentally challenged.
Yeah, yeah. So many people, when they say, when somebody says they need counseling, people tend to assume, okay, he might be, having a mental illness. No, that's not true. People can seek psychological therapy, psychological counseling whenever they're going through a difficult situation. They need not be having severe mental illnesses like a depressive disorder or psychotic disorder or anxiety disorder. They might be just going through a difficult time. For example, people come to us because of family issues. They're not able to deal with something going through the family, and they have come for advice on how to improve the situation. Some couples come to us because they want to improve their relationship. There are so many misunderstanding, miscommunication happening. So, how to improve that? Some people come for adjustment issues. They're going through a difficult time and how to go ahead with that. So they come for such situations as well, not just severe mental illness.
Thank you, ma'am. The next one is headache or any physical symptoms will be gone if I just sleep.
Yeah, yeah. I think it comes from our parents often or our elders that you should sleep properly, then it will go away. Yeah. So, some symptoms like headaches, aches, and pains, if they are happening because of fatigue or not being able to sleep properly, might go away with sleep, but not all headaches, like the migraine, like other types of headache. Tension headache often happens because of stress or difficulty sleeping. That headache might go away, but a headache like migraine may not go away. Sometimes there might be deficiency, there might be some internal injury which can cause backaches, stomach aches, etc. That might not just go away with rest, and you might need a professional help.
Thank you. The next one is that only people with mental disorders have to consult a psychiatrist.
Yeah, like I think it is similar to the first question that we discussed. That's not true. Anybody who is, going through a difficult time, who doesn't know how to go ahead with the situation they are in, about their career choice or their job difficulty, their academic stress, all of them approach us for professional help, not just because they're having severe mental illnesses.
The next one is similar, that counseling is only for people with severe mental illnesses and it's more of a sign of weakness.
Yeah, many people think so because emotional issues is always linked to someone's capacity, someone's strength and all. But that's not true. It is just like getting a fever, just like getting any appendicitis, gastritis, etc. It is that common, and it is not a sign of weakness to get help for that. Would you call somebody going through having dengue fever, if he goes to the hospital, would you call that person as weak? No, it is a sensible and a practical decision to seek help whenever you are going through a difficult time, be it physical or mental.
Thank you. The next one is more of a statement, ma'am, and that is actually this is a common myth, and this is a statement from a lot of people here. Actually, I found myself in situations where I needed help from someone like you. However, there are several issues that make it difficult. First, my family doesn't take these matters seriously, and sharing things with them only makes the situation more complicated. People also feel that they don't feel like I can trust my peers or friends. And on top of that, we can't visit a clinic in person due to certain restrictions. At the same time, we hesitate to trust online counseling services because we are afraid of online fraud and don't want to create another problem for myself.
Okay, right. Okay, so yeah, whenever it comes to seeking help for mental health issues, people go through various struggles. They face so many obstacles to seeking help, which is first of all usually the family. So family says statements like, "You should ignore such problems. It is just in your mind. It is a bad idea to get help." And earlier statements like psychiatric medicines are addictive, or a psychiatrist always prescribes medicines. So all this indicates basically stigma. Okay. You should identify when when you see somebody stigmatizing mental health. First of all, identify that, and since you are medicos, you should overcome it. You should not get influenced just because they are our parents or a close one. They can also be wrong. Okay. You're going through a difficult time. Do not listen to the advice of a non-professional person. They might be mistaken. They might be misinformed. Then, talking to family itself about your emotional problems sometimes can become complicated. Some family members are very understanding, some are informed, some might not be. So, they themselves might tell them, go to such a friend. You have only trustworthy people, talk to them. Otherwise, get professional help. Okay. Then you said you cannot go in person to a clinic. Again, I feel that is because of social stigma. You might be concerned that what if somebody sees me entering this clinic, they might judge me, right? So if you find yourself in such a situation, what I would advise is that we ourselves should overcome the stigma. Okay. If somebody judges you for going to get help, it is their problem. It is their lack of information and awareness, first of all. But okay, if that is one main reason preventing you from seeking help, online services are available. You said you are not, you are scared to seek online help because there might be fraudsters. So if you are going for online sessions, which might be because of access difficulties, there might not be psychiatrist or mental health clinic near you. Then online services are option. But always before you approach somebody or you go for a consultation, ask their qualification. Okay, you can these days you can even ask them what are their degrees. Okay, do not hesitate. If you go to a quack or an unqualified person, they might actually worsen your mental health by giving you wrong advice. So always verify their qualifications. Yeah. So I think that answered that question.
Thank you, ma'am. The next one is mental illness cannot be cured completely.
Okay. So that is again a wrong idea that mental illness cannot be cured. If you seek help, professional help on time, mental illness is always curable. Always remember all mental illnesses, if treated on time, most of them are curable. But if you seek help late, for example, illnesses like psychotic disorders, especially, if you get help very late, it might become chronic, so chronic and severe, it may become irreversible. But if you get help on time, usually it is curable. So the duration from where the symptoms start and the time point in which you seek help, that duration is important. Uh, and all most of the other illnesses like anxiety, depression, etc., are completely curable. But some illnesses are incurable only if you are too late to seek help.
Thank you, ma'am. The next one is people with mental health conditions are violent and unpredictable.
And that is not true. Again, people with mental illnesses do not often, unlike many people think, do not lose touch with reality. Okay. In conditions like anxiety and depression, they are suffering because of their excessive worries, their thoughts, their cognitive problems, and they usually do not become violent at all. In even in other conditions like psychotic disorders, manic disorders, OCD, etc., the chance for a person to become violent is very less. Okay, so that is a rare scenario, and if at all a person becomes violent, they should be taken to get professional help. But most of the time, if you there are studies which show that a patient coming to hospital without psychiatric illness is more likely to get agitated than a person with psychiatric illness. You might have heard of news like people beating up doctors or destroying property. Often they do not have psychiatric illness. It is their emotion regulation skills that is lacking, and etiquette and professional boundaries that are lacking. So the chance for getting beaten up by a person having psychiatric illness is less than getting beaten up by a person who is not having psychiatric illness.
Thank you, ma'am. That was very clear. The next one we have is that the concept of depression is that being sad is depression.
Yeah. I think I mentioned in one of the slides, we often use the term I'm depressed. That person is depressed very commonly, and it has become a common word, but it is wrong, and it kind of trivializes, people actually suffering from depression. Okay. Whenever you say you are depressed, it may not be always true. We call depression, like I said, we diagnose a person with depression when the symptoms are severe enough to cause dysfunction. They're not able to stop crying either, or they're not able to think of, thoughts about dying, suicide, like that. They're not able to sleep, eat properly. They're not able to function like a usual person. So that is when we say a person is depressed. And sadness, I would like to add, it is a human emotion which is sadness. Okay. So if you are feeling sad, there is nothing wrong. Only, it means you are human. If you don't feel sadness, there is something wrong with you. And some amount of sadness, helps us to appreciate when good.
So much, ma'am. So that marks the end of the mid-breaking session. So this was extremely helpful and meaningful, ma'am. Thank you so much, ma'am.
Okay.
I ask Pavishri to take over. Yes.
Thank you.
Can I ask a doubt, ma'am?
Yeah, sure. Who is this? Is this Pavishri? Yeah,
Yes,
you can ask.
Ma'am, can you explain about ADHD, ma'am? Like, is it can it cause a issue in our regular lives?
Yeah. So untreated or undiagnosed ADHD can cause problems in daily life. So ADHD, as you know, stands for Attention Deficit Hyperactivity Disorder, and ADHD has three features, three main components, which is first is inattention, wherein a person is not able to focus. They are easily distracted. They are not able to remember daily things. They often misplace things. They are forgetful. They make careless mistakes, because of which there are problems in daily life. Okay. Then there is hyperactivity. Hyperactivity is more common in children than in adults. In hyperactivity, a person has difficulty sitting in one place for a long time. They become fidgety. They start moving their legs a lot. They start playing with the objects in hand with their pen. They tend to disturb others. They want to go out. They make excuses and go out, which is all more common in children than in adults. The third component is impulsivity. In impulsivity, they have difficulty controlling their impulses, like they can't wait for somebody to finish talking. They want to interrupt. They cannot wait in turn. They cannot they have difficulty waiting in a queue, etc. So these are the three components of ADHD. There can be childhood onset ADHD, which usually uh, in 1/3 of the people progresses to adulthood ADHD, and by the age of 18 to 25 years, hyperactivity usually comes down. Inattention and impulsivity may persist. When should you seek help is when it is causing dysfunction and causing lot of problems in your daily life. Some amount of inattention is normal. For example, a person can have attention span ranging from 20 to 40 minutes. Okay, some people get zoned out or distracted after that, but you can actually consciously bring your attention back. And in some people, impulsivity can be, managed to some extent. And it is not causing, if it is not causing dysfunction, it's not affecting your academics, career, or you're not making so many errors that it is causing a big problem, it is fine. You're able to manage, means it is fine. But if it is causing dysfunction, it's causing distress to you and people around you, you should seek help. I hope I answered your question.
Yes, ma'am. Thank you, ma'am. As we come to the close of today's session, it's my privilege to deliver the vote of thanks. First and foremost, I extend our heartfelt gratitude to Dr. Aiswarya R. Kamath ma'am for sharing your valuable time, expertise, and insights with us today. Your candid, compassionate, and relatable approach to such an important topic has truly left a lasting impact on all of us. Today's discussion reminded us that mental health is not merely something we study or treat in others, but something we must also acknowledge, protect, and care for within ourselves. We are deeply honored by your presence and grateful for openness and wisdom you brought to this session, ma'am. I would also like to express our sincere thanks to the respected patrons and state leadership of IMA Tamil Nadu State Branch for their continuous support, encouragement, and guidance in organizing this webinar. A special note of gratitude to Dr. Arunagiri sir, Dr. Ajay Karthik sir, Dr. Bala Hariharan sir, Dr. Hariram sir for your constant motivation, leadership, and unwavering support throughout the planning of this event. My heartfelt appreciation also goes to the entire state team for their coordination and collective efforts in making this session a success. I would especially like to thank our organizing team